Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I am a nutritional therapy practitioner.
That's correct.
And I'm joined today, as always, by my amazing co-host, Dr. Jason Martin. I feel like there should be a, what is it? It's not centenarian. It's, what is a 200th?
Why did you have to bring that up right out of the gate?
A 200th episode?
error. Yes.
So I feel like there should be like, if you're watching this, you should definitely be watching this. If you're not watching it, go to YouTube because I have a crown. It is our 200th episode.
Let's go.
Cue the fireworks.
Yes.
And I'm going to turn it over to our amazing co-host, Nils. Viking Nils.
Yeah.
Gorgeous Nils. And we don't know what's coming, Dr. Martin.
I didn't get the memo on the fact that we were supposed to dress up, just so you know.
Well, you are dressed up. You're wearing scrubs.
That's true.
Yeah.
Okay.
Yep. Yeah, we got, well, this is my formal wear. This is what
This is what he wears to work every day.
Yes.
This
This is how he always looks.
Yes.
Yeah.
You guys usually see me in my own scrubs, but today I'm in my regular clothes. All right. Well, congratulations, you two. You put in a ton of work. This is like literally over 200 hours of content that you've put out to all our great listeners. So
You have had to listen to us talk, Nils, for thousands and thousands and thousands of hours.
I've learned so much. It's been great. So let's get into it. So the first slide that I got here, this is a picture from episode 100.
Wow.
You babies there.
I mean, look how much my crown has grown.
I like how I look there. I mean, that's not bad.
You look dapper.
Yeah, let's go.
We had the bands. That's
Yeah.
right.
Yeah, we had the bands.
Yes.
And as you guys pointed out when I said, I'll get some decorations, you're like, there's no 200 decorations because no one lives that long. So
sea turtles
had
do.
to be,
I mean,
yeah,
and trees, basically
trees.
in deserts.
Sea turtles, I love it. So, and quick fact there, on episode 100, June 1st, 2021, we had 649 subscribers on YouTube.
Serious?
That was our count, right?
Wow.
And since then, we have added 7,100 plus subscribers. So we're up around 7,800 total.
Nice.
Wow.
So that is a 1,100% increase.
Yeah, we're really killing it.
So even though it's a slow crawl, it shows.
We're like crawling, but a little bit faster.
We are a turtle.
Yeah.
Faster.
Watch out.
Yes, we're a tortoise with roller
We're taking over
skates.
mainstream media probably next year.
So thank you to everyone who subscribes, tell your friends, all that. I mean, it really helps us, push things forward. And the next two episodes are going to be listener questions, which we love doing, and it really helps us provide content and know what you guys are thinking about. So that's that. So to start, we are going to play Who Said It?
I love this game.
All right.
Pretty much Amy said everything, I think.
No.
So in this game, I will give you a quote from one of the past 200 podcasts, and you have to tell me who said it. Was it Dr. Martin?
Yes.
Was it Amy? Was it producer Nils? Or was it a listener?
This is difficult.
Okay,
This is
so
very
you have
difficult.
4 options.
Very difficult.
Okay. So if you get it right, you get a point. If you get it wrong, the other person gets a chance to steal.
Okay.
Rock, paper, scissors to see who goes first.
Ready?
Whenever you're ready.
1, 2, 3, throw. Sucker.
My crown.
Sucker.
That one's a little
I lost my crown.
Don't you know if you ever throw rock, you throw rock again?
That's why I threw
That's what the
scissors. I
statistics show.
thought you were gonna paper
That
again.
was great.
All right, I go
Yeah.
first.
That one's a
Right.
little heavier than your last
It
one.
is. I got to be careful.
When I got it, I was like,
Right?
ooh, that thing's got some weight.
This is the whole keep your head up. Don't let
Right.
your crown fall.
Very good.
Heavy is the head that wears the crown.
All right.
I'm learning.
Dr. Martin, this is the first one.
Yep.
The quote is, I consider us normal people.
I think that's probably me, but it's definitely not you, and it may be Amy. I'm going to say me. I don't know.
That's correct.
Yeah.
It is you. That was episode 135 research.
It's
We're into
definitely something I would say.
Yeah.
That's in my repertoire.
Yes, I think you're leading into something. Well, I consider us normal. Like, it was a good one.
I usually ask questions hoping that I get the positive answer back, so I'm not
Exactly.
like the weird Reddit thing was also that.
Yes.
When I was like saying weird Reddit, Amy was correcting me. I'm like, okay, thank God she's correcting me because I don't want to sit this out into the airwaves that I'm on weird Reddit.
No, normal people are not on weird Reddit.
Are you ready, Amy?
All right, now Amy, it's your turn.
Okay.
Okay, here's the next one. By the way, in Sweden, fat is used as an adjective that means awesome or badass.
Yes.
That was a listener.
Blah, 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 blah.
Blah, blah, blah.
Wow.
Yes.
You guys are
Yeah.
good.
Love,
You
blah,
even
blah,
got
blah.
the name.
Oh,
Mhm.
in that episode, if you go watch it, she shows a picture of Sweden, I think.
No, she sent them to us.
And there was
Yeah.
a license plate that had something on it was plastic surgery related. But we were all just focusing on the background of it. And we're like, God damn
It's
it, I want to
gorgeous
go
there.
there,
Yeah.
please.
Yes.
Oh,
Yeah.
yes.
Yeah, she also sent us, it was
Gorgeous.
boxes, and I can't remember why it was meaningful, but like I did get the joke. So blah, blah, blah. If you still listen, and I know you
Yeah.
had your eyes done, and like you're an OG.
She'll rotate back around. She'll see this. Yeah.
Nice. Very good. So, gotta keep track. 1-1.
That's right.
All right. Dr. Martin, here's yours. So blood sausage actually has blood in it?
So that was definitely me. I remember saying that to Amy.
It's the botulism episode.
Right. And I was so taken back that there was actually blood in blood sausage.
Yes.
That's true.
And Amy was looking at me like, what world do you live in?
Right? Like there's absolutely
Is this
blood
a
in blood
common
sausage.
theme that everyone knows that blood sausage actually has blood in it?
Well, I'm German, so yes.
Okay.
I didn't know that for a long time. I
Yeah.
think I might have learned that recently. So, but yes, that was episode 120, Botox. Now I'm starting to think these are too easy because you guys have way better memories than
No.
I do.
So, dude, you guys remember that episode is actually a really good episode, but that was the reason, that was how they found botulism. Basically, they were feeding blood sausage to people, and
right,
the botulism
yes.
comes from a cow, I think.
No, botulism can grow on anything.
I know growing
it can
thing,
even
but
grow in soil.
I guess it was
They
more cows.
thought
They
it
were
was.
pork.
They thought it was the blood sausage, but it could just be anything.
Right. That was the story.
They had no refrigeration.
They had no idea what it was at the
Yeah.
time, but they thought it was the blood sausage.
Yeah.
So
Gotcha.
botulism, I think, in itself, in translation, was more in German was more about blood sausage-ism.
Well, this
That's right.
That was the
okay,
name of the
yep.
disease.
my favorite thing in this episode though was the guy who figured this out was he was like something else and a doctor, like because back in the olden times you could
Like
be
a
like
blacksmith. and
yeah,
everything.
and the doctor.
Yeah, he did
Yeah.
wagon wheels
Mhm.
and he did
He was
surgery.
doctoring. Yes.
Oh, that's great. Oh man. Okay. So now it's on to Amy. Here's the next one. They can sleep standing up like a horse.
That was Nils.
You're right.
That was
Producer Nils.
Nils.
And that was things we wish you knew
I was-
before
yeah,
having a
that's
I
what
was
rhinoplasty.
dying laughing when he
Yeah.
said that. Like that's one of my favorite moments of the podcast.
There's probably a lot of plastic surgery procedures that we do that if you slept standing up like a horse, you would be better off.
Would be better. Yeah.
Yes.
I remember
Fat
that.
transfer for
So
sure.
This clip made it into the mashup.
Oh, it did?
That's-
Yes.
Okay,
Yep. Yep.
Yeah.
But yeah, it was because we often discuss with tons of different procedures, of course, recovery and sleeping. And it's just like Dr. Martin's always like, well, then how do you, and then how do you, and
Yeah.
like, would this work and that? Because it seems to be just a science within itself that,
Yeah.
people have to kind of figure out how they can get comfortable without doing certain things that could cause a lot of problems.
Which is
like
why
laying-
you have the sleep expert, Amy, the poop expert, Amy, the sex expert, Amy.
the pillow expert.
Yeah, the pillow
Amy,
expert,
Amy,
yes.
Yep,
Also great for sex. Those pillows.
Yep.
Mhm.
All right.
TMI.
Just telling this to the people.
The
Like,
people's.
you know how many times I say that to people? Like when they ask me when they can have sex again after surgery, I'm like, use your pillows.
Yeah.
Like find some positions.
I know
that
it's
are
a
good.
lot because
There
I
you
get asked it a lot. I'm like, that's an Amy question.
Yes.
Yes.
Awesome. Okay.
All right, Dr. Martin's winning. Good.
So yes. Well, no, it's tied, right?
I know it's tied now.
Yes, it's
Come on.
It's tied for now.
I'm like, wait, did I mark that right?
Don't worry about it. I got the score in my head movie.
Like I said, I think these are too easy for you guys, but that's all right. Okay, Dr. Martin, next one for you.
Yeah.
Somehow you're so strong that you're going to force that implant out of that pocket with your massive she chest.
That's definitely Amy. I remember this absolutely.
It is.
That was breast
Amy.
augmentation myths, which is actually right here if you want to watch it.
Yep.
It's such a good episode.
It's a
I
great
absolutely remember Amy saying this. Only reason I wouldn't have said it because it has a little misogyny out of my mouth. If
You
I
wouldn't
would have
say
said
she
that.
chest.
I wouldn't say she chest, but I remember this 100%. It's so
was
funny how
good.
much I remember.
Yeah, you guys
mean,
are really good.
yeah.
Yeah. And yeah, like you said, that's a really good episode.
All the myth episodes are good.
Yeah,
It's a really good way just to kind of break down the facts of breast aug.
I agree.
It's great. All right. To try and tie it up here.
Man, this is so much pressure.
Amy. Let's see. Planters, dry roasted peanuts. and
That was a
rock
listener.
candy
I think it was
corn.
Robin.
Handfuls Yummalicious. By the Handfuls Yummalicious.
Yeah, that was a listener.
Was it Robin?
It was. Well, here's the rest of it.
Oh, Jenny. Jenny. That's
yes.
right.
So she
Yes.
also followed it up with "Don't yuck our yum."
Yep.
LOL. And thank you so much for your channel.
Love it, Jenny. I knew it was one of the. It was either. I'm like, yeah, Jenny or Robin.
Listener Jenny Grammer. Yes.
Oh.
I was very upset with Jenny because Amy has like a fetish with these candy corns, and when she says candy corns, she says it like a pervert.
You know, one
Like
of these.
candy corn.
One of these years.
She's aroused.
It's
And
not.
it's disturbing because she's like my sister. I don't want to
Candy
hear Amy
corn.
aroused at candy corns.
It's not going to be this year, but one of these years, I won't be in prep during candy corn season.
Yes.
There you go.
It's
good.
it's
You
not
can
this
enjoy
year,
it
unfortunately.
once again.
Your
Yep.
teeth are going to be all yellow and orange.
Like I was in TJ Maxx this weekend, and they had the coffee flavors, and they actually have a candy corn one, and I was
Oh,
seriously
my
like
God.
staring at it. I'm like, don't do it. It's not going to taste good because you can't fake candy corn. Candy corn has to be Brock's. It has to be fresh. It has to be candy corn.
I think we all agree that candy corn is just straight sugar and
it's-
gelatin. I mean,
It's honey.
with color in it.
Yes. Why is
I
it?
don't want to get
just
Jenny
like
mad
a
again. But
perfect
like,
little
I
pyramid?
don't find that. Whatever. This we can keep going.
Oh, so good.
We're not going to rehash this. I
Oh,
remember
yes.
this vividly, by the way. I
I
feel
was-
like I'm reliving this episode.
And it is delicious with peanuts because then you get that little bit of salty and a little bit of crunch because like you start craving the crunch when you've had just the chewy.
Yeah. Okay.
you
So
go.
delicious.
Or peanuts are just really good. All
Peanuts are
next
good, too.
question.
Next question.
Well, yes, and I was looking for a candy corn one, and then I went, "Oh wait, there's a good listener one," so that's
Yeah.
how I dug that one.
I also at
So,
one point I know that I was a marshmallow candy corn
yeah,
at one point.
Yeah,
on the
you
pod.
were.
Yeah.
It was pretty good.
One of those.
And I didn't even know what a squishmallow was.
You know now.
Yeah, I know now.
Mm-hmm.
Squishmallow.
Squishmallows. Mhm.
All right. Well, I know that was pretty quick, but we're gonna take a quick break,
Okay.
and then we'll get back to game number 2.
See ya.
I'm going to adjust my crown. And we're back. And we tied.
We
So-
did tie, but did we mention
Yep.
we have bobblehead here too? Yeah, sorry.
Bobblehead. Read what your bobblehead has to say.
Oh yeah, this is really good. Nils, you don't even know this.
No.
It was from a tea bag.
Mhm.
It says inner peace creates peace in the world.
Okay.
So when I get angry at the clinic, I come in and myself is staring back at me with this
Telling
around
you
its
to have inner peace.
lapel
With your
area.
wisdom
Yes.
hanging around your neck. All right.
Yes.
I like.
Yep. Yeah. So
That's
we're
great.
going to turn back over to Nils.
Let's go.
All right. Yes. And okay. So now we're going into game number 2.
Nice.
Maybe this one will be a little harder. Let's see.
Sounds so menacing when he
Yes.
says it wearing his
I
normal
forget,
clothes.
You guys memorize like the entire anatomy of the body. These
Yeah.
probably aren't that hard.
Amy
for
and
you.
I are like annoying to be around in that sense. I mean, Amy kills me on music though. It's crazy.
Oh,
She'll
that's-
start saying full lyrics to songs that are like esoteric. What's the butterfly song that you like we always talk about in early 2000s?
It's called Crazy.
Crazy.
Yep. Mm-hmm.
She
You're my
knows
butterfly, sugar baby.
every line in that
That's
song. It is how?
I know. I
How
wish
does she even keep it in her head?
that's unfortunately it takes up the space that a lot of smart things could have been in
Right.
instead.
Yeah, it is taking up room.
Yeah.
You
We
know,
need to ship that out.
I've tried.
Yeah.
Well, if you're ever arguing with someone who said that what you said, that's not what you said, you can be like, Nils has proof that I remember everything I say over 200 episodes of a
Mhm.
podcast. So,
Yeah, yeah.
Good job.
My
Yeah.
wife's not going to go for that. Nils. And Amy, neither would Amy. I told you this. No, you did. Yeah, I did. I'm like, okay. I have to roll over. It's not a good position to be in.
All right. Game number 2 is called Fill in the Blank.
Ooh,
Yes,
this is
perfect.
going to be harder.
All right.
This is going to
Okay.
be harder. I think this is where
All right.
the demarcation is going to come from.
Okay, yes. In this game, I will again give you a quote, but this time you have to guess the missing word or words. If you get it right, 2 points. If you get it wrong, the other person gets to steal.
Okay.
Rock, paper, scissors. See who goes first.
Okay,
All right,
ready?
here we go again.
Okay. Remember, if you throw rock, you have to throw a rock again.
Oh, okay. I'll be for sure to do that.
1, 2, 3, throw.
Ha!
Damn it. Like I was getting in your head.
Uh-huh.
You weren't supposed to throw a rock. You're supposed to throw paper.
Like say rock again.
Yeah.
Yeah, all right. So Amy starts this one, and it's 4-4 right now. Okay. First one. You do give off those Dr. Blank vibes. You have that look.
Doctor Strange vibes.
She got it, Doctor
Son of a
Strange.
bitch. Why did you have to pick one that
Yep.
hits me
Because
internally?
a patient said that, it was a comment. I mean, a commenter said that, and when I read
don't look like Benjamin Cumberbatch or whatever that guy's name is.
You do.
Benedict. I do not.
you give off but it's the Doctor Strange vibes. And I know you thought that he was a bad guy, but he really wasn't. He was a good
kind
guy.
of a dick in the movie.
But he was a good guy.
Okay.
Yeah.
He saved the world at the end, but there was like half the
Exactly.
movie was about him being very difficult to work with.
Well,
Feeling a little bit sensitive about it.
I mean, I'll take difficult to work with if you're going to save the world.
That's true. That's
Yeah.
There you go.
Yeah.
For the better good.
Benedict Cumberbatch, he's a good actor. I'll take that. I'll take
Yes,
that. That's
yeah.
good. Okay.
I remember the night before one of our recordings, I had watched, I think, the new one of them, and I was like, yeah, you really.
He does.
I was watching that movie going like, I feel like I'm watching
Yes.
Dr. Martin.
That's so sad.
I mean, people say that about you. The most recent comment about me was that I seem flighty.
Oh, no. The most recent comment about me was, can you shut the hell up and let that woman talk?
And then followed up by, she seems flighty. I don't like her.
Yeah.
Which I honestly took the flighty as a compliment because it was on one of the episodes when I think I was like deep in prep. I'm like, the fact that I had personality at all.
Yeah.
There we go.
Yeah.
Yes, low energy.
Yeah.
Some of
This
those
is a hard
episodes.
one. I think this
All right,
may be
we'll
my
see.
undoing.
We'll
So we'll see what
see.
the next one is.
Doctor
Okay.
Strange.
Here you go, Dr. Martin.
Body doesn't know if it's been cut by a...
Blank,
Oh
blank.
my gosh, I know this
Oh,
one.
I know this one. I said this.
Wait, I got to read the whole thing.
Okay, sorry.
Just in case someone's listening, not watching. The body doesn't know if it's been cut by a blank blank or if you've had a tummy tuck.
Yeah, I for sure remember this. This is the Tummy Tuck episode. I think it's the OG one,
Mm-hmm. The original.
not the second one. But whatever the case was, I said a samurai sword.
Mhm.
That's right.
Yes.
And it was
Listener
actually
questions.
126 listener questions.
Oh, that's interesting.
Yeah.
I think we might have said it before.
You
It
might
doesn't
have
matter.
said it before, but that was.
We've said it a lot of
We've
times
said
since.
it, yes. But according to my notes, it was like the first time I had it tagged. As
Tagged,
like
yeah,
a funny
yeah, I get
thing.
you.
So,
So we'll stay with listener episode 126.
Still
Which is
tied.
very funny because literally it does not know that it had a tummy tuck.
Yeah.
We say
It's
it
a
all the-
really good. I tell people that when we're talking about
Right.
like
Injury
stuff
and
I've
surgery.
learned, I'm like, well, it's just injury. You don't
Mhm.
know,
Right.
know. And it was just a really good way of
And not
letting
to bring-
people understand.
Not to bring clinical stuff in, but I was just talking to a woman who really does have autoimmune issues and difficulty with inflammation. And she takes anti-inflammatory drugs. And
Mhm.
her thought process on doing surgery was that having less inflammation would let her
Less tissue, you mean?
heal better. And I told her that actually it would make you heal worse.
Yeah.
Inflammation is needed to instigate wound healing. So if you don't have that, it's like being on steroids. It's like having diabetes. You just don't heal well. Sorry to be clinical. Excuse me. I'm wearing my scrubs.
I was gonna say, like, you're wearing your doctor costume.
Yeah.
You can
All
be
right.
doctor.
Stop being clinical. Okay, back to it.
All right.
No fun anymore.
Here we go, Amy. It will be my first non-blank tattoo.
Non-prison tattoo. And this was said by Nils. After Dr. Martin was asking him if he got a new tattoo, if he would like have a showing off party.
That's
Like the
right.
swan of tattoos.
And we remember that one because he got it with his nephew.
Yep.
Mm-hmm.
And
It's cool too.
It's a cool tattoo. It's very specialized. When I first met Nils,
It's
we told
covered
this
up by
story
his
before,
arm cuffs. There it is.
which is why Nils even proposed to us that we should do a podcast. I met Nils and I was taking something off his head, which was below my training level. Okay, but I was happy to do it for him because he was such a nice guy. And I think at that time I asked you, it was like, why do you have all these prison tattoos?
I think what you actually said was like, you seem really smart for a guy who has a lot of prison
Oh,
tattoos.
is that what I said?
Yeah, it's a good way to like buffer the insult that was
Yeah.
coming.
Yes. And you're one of the nicest people I've ever met.
And has
I was,
never
like,
been in
insulting you
prison.
The first time I met you.
Has not been in prison.
Yes. Maybe I am Doctor Strange. Okay.
Sounds like something Dr. Strange
Yeah,
would
exactly.
say. Yes. No, but yes, I tell people that story and they love it. It sums you up pretty good, dude.
Yeah.
Like, so yeah. All right. All right. So back to Dr. Martin. Here we go. Now this one I gave you. Who said it?
Yeah.
You're the only one who could win this, Amy says. And Jason says, I'm going to blank my own blank.
God. You know what comes to my head, which is just not it, is I'm going to toot my own horn,
Okay.
but that's not it. And I remember what episode this is from. I can't remember it.
Ooh, pass to Amy for a steal.
I know what episode this is from, but I just don't know the words.
Yeah. I can picture myself saying it like, you're the only one who can win this.
Okay, wait. Okay, this is do this together then.
Okay.
Right? Okay. So, man, what was it?
I feel like I can hear you saying it in
Oh
my
my
head.
God, this is terrible. It was something about me being something, but related to surgery because I'm the only one that can do it. It wasn't like a personal thing. And this is
I feel like this was from a grab bag episode where you were wanting to win.
It was. Yeah. I don't
Finally
know.
stumped you guys.
Yeah.
I was worried that all of these were just gonna go right by you. All right, here we go. I'm gonna kick my own ass.
Oh, there we go.
When it was on Lip Lift, we were way off.
Yeah,
This was the Be Your Best Self challenge.
Yes.
Oh.
So in case you need context, let's watch the clip.
Yeah.
So, Dr. Martin, will you accept this challenge?
100% I'm accepting this challenge. Is this something that I could be number one in? Yes.
Yes, this is literally yours. Yes.
Can I win this?
You are literally the only person on earth who can win this.
I know.
Yes. So only you can
I'm
win
going to
this.
kick my own ass.
Yes. Ace Ventura style.
Yes, exactly.
Or
That
was
is
it
so funny.
Liar Liar?
I totally remember this.
It's the delivery of it
Yeah.
that just got me every time.
Oh my goodness. Okay, so do you remember, because you were having an epic birthday that year, I challenged you with something.
Yeah, that's right.
And when we did the follow-up we did the episode, what your thing was going to be, you brought in like an outline of like your manifesto
Yes.
to like write a book,
right,
create a movie, save the world.
And
Like,
it was written like the Unabomber
Yeah.
on the typewriter.
yep. And I was like, I'm going to do a photo shoot. Well, so instead I went on to become a bikini competitor.
And I didn't do
And
any
I'm
of mine.
still trying to get you to write a book.
Exactly. I haven't written a book yet.
55 is your year for book writing.
It was so funny. I think why I remember this now, and that was on the tip of my tongue, something like that. I wouldn't have picked the right words, but I think what I was getting tripped up about, this is actually a nice story about Amy. There was one time when we were first starting out, we were like younger, and I was just frustrated.
A lot younger.
I was frustrated. I was really like frustrated. I was like, we do such a good job, and it's such a weird business to be in. And, it's easy in medicine because you just take care of people and do the right thing. But there's a lot of other things going on that really make it difficult. And what was that Imagine Dragons song?
Yeah, it's
You're the captain of the ship. You're
yes.
that line.
First things first. I'm gonna
that's-
say all the words.
It's inside my head.
Yeah, because you were ranting. You're like,
yeah. I was like, and you're just like that Imagine
Yes.
Dragons song. First things first.
I'm gonna
And then
say
when
all
I
the
was
thoughts
reading
inside
that,
my
that's
head.
all I was thinking about was the Imagine Dragons
Yes,
song.
because you said to me,
It
like,
was like
you
a
were like,
brainworm.
you were like very heated. You were like, I just want to say the things inside my head.
And she's listening.
Yeah.
She's not even pushing
No,
back.
I was like, bring it on. Like, let me have it. Yep. And so I sent you that. Yep.
Yeah.
And I'm the captain of my ship. Like that song, like that is your song.
That is my song.
Yes,
I'm the
first things
captain of the
first.
ship. I'm the wind behind my sails.
Yeah.
Or so.
I'm
Now
gonna
I sound
say
like
all the
Celine
thoughts
Dion.
inside my head
Yeah.
because I'm
sorry,
tired
Nils.
up and fired up the way that things have been.
Yes.
Oh.
Yes.
The way that things have been.
It's
Don't
funny to think that Imagine
copyright us,
Dragons are
YouTube.
like old. Yeah.
They are. That was a long
They
time
live in
ago.
Colorado, by the way, apparently.
Imagine
Imagine
Dragons?
Dragons?
Yeah,
Oh,
one of the guys
I had no
does.
idea.
Yeah.
That's a good place to
In
live.
Denver.
It's a good place.
We
to
like
live.
it.
It's nice out there today.
Well,
for
so we
sure.
both missed that one, so we're still
Yeah.
tied.
So no, Amy, you're winning because that went back to Jason and he didn't get it and you didn't steal. So you.
Oh, 'cause I
Dr. Martin
started.
got one. You started one, and then Dr. Martin.
Okay.
won, and then you got one.
Okay.
She deserves it.
Uh-oh.
man.
Well, we're not done yet.
She has a better memory than me.
I didn't know that one either.
Yeah, that's the one that stumped you. All right. So this one goes back to Amy. I told him to elevate his legs. I'm not going to tell him to elevate his blank.
Scrotum.
Yes.
And I said it.
I remember this.
I was wondering if you'd remember.
No,
Yes,
I totally remember
I sure
this.
do.
I remember this episode. I
Well,
remember her saying,
just in
okay.
case, let's go to the clip.
Suction. We said this story before, and a man and we did a pretty aggressive liposuction on his abdomen, and his scrotum swelled up to almost double the size because all that swelling fluid went down in there.
Well, it turns kind of
And-
purpley because it's
yeah,
bruised,
he
not
thought
because
he
it's like
had-
avascular.
Like, I had a severe problem.
Yeah. Well, and he was
And I was like,
talking.
"You're fine." He's like, "Are you sure?"
Yeah.
And Amy's like, "Just elevate it." And I'm like, "Okay."
No, I told him to elevate his legs. Like, I didn't tell him to elevate his scrotum. Like, you need to get your legs up. Like, it's some of
I
that.
took it as elevate the scrotum,
No,
but that's
that's
just
not it.
what I heard.
Like, lift your balls, boys. Balls up.
That one got me good. That's a fun. One of my highlights.
I think what we're learning here is if something weird is being said, it's being said by me.
Yes.
right. I think there's 2 more. So
Okay.
let's see. We're going back to Dr. Martin.
All right.
All right.
Pressure's on.
Go. I didn't want him to be angry at my blank. I wanted soft nice.
Hmm.
This is a hard one.
I know some of the hard ones have gone to you.
All right. I didn't want him to be angry at my blank. I wanted soft nice.
Soft nice.
So that is definitely not me.
This had to be a listener.
Had to be a listener. Are we still doing listener, Amy, Dr. Martin?
No, it's just the word.
Oh, okay.
Yeah, it
You don't
doesn't
have to
matter
guess who
said
it is.
Yeah.
Yep.
Voice? I don't know.
Nice. That was actually you. You said feet.
I totally remember this stuff.
This was recent,
No,
too.
this is when we were
One
getting
night, this was
married.
only a few
Exactly.
episodes
Nils,
ago.
that is so esoteric but awesome. I was getting married. We had no money. My wife wanted to do her nails.
Yes.
Right? And that was a big deal. So we had literally no
Yes.
money. And I was like, okay, this is awesome. It's like kind of like a marriage present. And she's like, you should come get your nails done. And I got the one man in the Korean nail salon.
Who wanted
God
to
bless those
attack your
people.
feet.
And he was the meanest person I've ever been. And he attacked my feet. It was the most uncomfortable experience of my entire life. That is such a good one.
That's a
you
good
pulled
one.
that one
That
out.
was out. Well, let's do the question.
Yeah.
Are you ticklish?
I'm more irritated by people trying to tickle me. So like, yes, I feel like everyone is ticklish, but like things like pedicures, oh gosh, like my feet are so sensitive, like it like creeps me out the whole time.
The one pedicure I ever got, it was right before we got married. We had no money at the time. It's a long time ago, obviously. And my wife was like, I want you to come with me and get a pedicure. I was like, I really don't want to go. And she's like, I really want you to come. And I went there and I didn't get the nice, soft-handed lady. I got the brutal man who treated my feet like he was angry at the world. And it was the most annoying, terrible experience of my entire life.
See, and I'm actually better with that because it's the creepy light touch, like that tickly kind of touch.
I didn't want him to be angry at my feet.
Aw.
I wanted soft, nice.
See,
I
the
didn't
soft nice
get-
is tickly.
Okay.
Yeah.
I love it.
Don't be angry. Just be soft, nice.
I just wanted soft nice. I got Sarah too. She thought.
The only
funny.
episode where you were ever less tan than me.
I know,
where I was more
exactly.
tan than you.
That was fake, though. on
Yeah, it
your
was.
part.
Well, you sat down, you're like, oh, you look
Spray
nice. You wearing makeup. And I was like, no, man, I'm tan.
Oh, yeah. Spray tan, though.
It was spray tan. Yeah, it was faux tan. Yep.
All right, Amy won, but we'll just do this last one. See if I
yes,
can
we'll
redeem
do this
myself.
last one. If you guys want to take it on together, you can, because Amy's got 4
I gotta see if I can get it
4.8.
first.
Yes.
Okay.
And you will. This is.
Oh, okay.
This is
Is this I'm a board certified plastic surgeon?
close.
Is
Let's
this,
take a ride.
Is this
on,
her trying to pronounce?
Magic school bus.
Yeah.
Sorry, I didn't mean to jump on
No.
you.
I was just like, this is her trying to pronounce ear, nose, and throat doctor.
Otolaryngologist.
Yeah.
I'm still waiting for the rap mix of otolaryngologist.
Odo.
Otolaryngologist.
Yeah. I remember what episode. Before, don't tell us what
Yep.
episode was that from.
Nerve system. Like
That-
numbness. Yep. The one
that-
about nerves.
Was it?
Oh, just for the listeners too. It was let's take a ride on the blank, 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 and it is Magic School Bus. This one was from 145 liposuction
liposuction.
myths.
Yeah, exactly.
but-
I say
she
it a lot.
She said it twice.
and many others. 'cause
yeah, she said it on the nerve episode. But here's the liposuction
Yes.
myths episode, which is amazing. By the
And
way.
like seriously, if you can put me in the magic school bus, I even have the curly hair like she did.
yeah.
I looked at that and it would be really hard
To put me in the magic school bus?
because I was trying to find some kind of way of editing that in.
Can you just shrink me down and put me inside the human body, like
So
inside a
I'll-
vessel?
That's what
I'll-
Mr. Gubbody did.
I'll look at it. As
Oh,
long as
he
it-
was inside out, man.
Yeah,
He was
Mr. Goodbody,
creepy.
Yeah, the creepy
Yeah.
leotard. Yeah.
With curly hair that went down to
Yep.
his shoulders.
Yeah, he
Not
was-
weird.
So that was it. Amy is a winner. That was fill in the blank.
We're
Good
both,
job, you
I think what we
guys.
learned from that is that we are all winners.
Yeah, we're all winners here.
All winners. And you guys say the darndest things.
Yes, we do.
All right. So for the last thing, when I reached out to you guys, I said, why don't you go back through the top 5s that we've been doing for the last 6 years? I thought there were like 4 and there were 6. So
'Cause
it's like,
time.
it's like, yeah, I think all the way back to 2019. And I said, if you go and look at, go pick a year, go in there and find your favorite clip from that year.
I didn't need to look because I have a mine. I didn't even need to look at I didn't even need to look at any of them. Like I already
So
know.
I have to tell you, I tried to get one from last year because that's when all of our stuff went to 4K, just because
Yes.
the visuals
Oh.
look
'Cause you
better.
like it a look. Yeah.
Yeah,
like
yeah.
a look.
But then I was like, there's no, I got to go back.
Yeah.
So
Yeah.
I found the one that I really wanted, actually.
Yeah, I appreciate it. Yeah, but Amy got hers me
Oh, yeah.
quickly.
As soon as I read it, I'm like, I know. I don't
You're
even
like,
I don't
"Mine's
even need to
this."
watch these.
That's
I
funny.
appreciated that he linked them
So-
all for us, but like I knew.
Let's go.
Yes. All right.
We found out from Nils that, ironically enough, with all of the episodes we had to choose from this year, Dr. Martin and I actually chose the same number 4 clip,
Because that's where we are now in our lives. Yeah.
which is
We're like an old married
it's
couple.
so shocking because I went back and forth on a lot of mine over the course of the year.
I don't even remember what our 4 was.
So the fact that we had a joint number 4, I just found so surprising, and I have not. Yeah, so let's hear our joint number 4.
What are we talking about,
Say it
Amy?
all.
What are we talking
Today
about?
we are continuing our myth busting series, and we were talking about brachioplasty myths, which is arm lift myths. But arm lift myths is harder to say than brachioplasty myths.
Arm lift mist.
Myths. So yeah, so we have 10 myths to
It's
go
not-
over today. It's hard to say.
You said it slowly, didn't you?
Yeah, right.
No, I didn't even get it right. I said
yeah.
mist.
And you
like,
were thinking about it.
yeah.
Like mist myths. So let's jump right in. If
I think an arm lift mists doesn't sound good. It doesn't seem like it would smell very good
sounds
either.
messy.
Yeah.
So you have sick arms. I was watching one of our videos back, and there's actually Nils used a clip of us flexing in one of our
Thumbnails.
tile slides. Yeah. And I'm like, man, that's so unfair to have to flex next to you. It's not fair at all. Like,
I don't agree that I have sick arms, but
like the
I mean
little
that's
baby
a little bit
bicep.
unfair. I mean, you're a female and I'm male, so our physiologic makeup is a little bit
yeah,
different.
but your arms are much bigger than mine, and
Okay.
it's so unfair.
All right,
I have serious bicep
everyone,
envy.
calm down. Okay.
Yeah. So
We're not making our money off of your arms or my arms.
no.
Yeah.
But my point is that the scar is hidden, and if people
It's-
do see your scar, the thing they jump to is not, wow, that person had a brachioplasty, and who cares if it was?
I cannot remember a patient that we've done a brachioplasty on come in and say that I'm really upset with the scars or tell us a story about how they were embarrassed, et cetera, et cetera. Secondly, who is looking at people's scars? Like who is doing that?
Yep.
When you talk to people, you look at their eyes, their face. I mean, I never scan people's bodies to check out like what surgical scars they have. And
Well,
I'm
if
a
somebody
surgeon.
says like, oh my gosh, what happened? Just say I had surgery.
Yeah.
And if they want to keep talking about it, you don't have to keep talking about it with
Right.
them. Like,
It's your business.
exactly.
It's your BIZ-ness.
Yes. So that's busted. You will not still have to hide your arms.
Should we? Who's saying busted? This
You are,
time?
because that's your
Okay.
thing.
Okay. Busted. I don't want to steal the thunder,
No, that's your thing. Number 2.
but you're my coworker. You know, I should share.
The busted thing is yours.
All right.
So what is this myth?
Amy, I'm going to say this bit that
See, it's hard.
you have infected my brain.
This is so much fun.
I'm going to say this myth is busted.
Busted. Like this one, I feel like we don't need to belabor the point. Don't do it. Get a consultation with
I
a
know,
board
but that's my
plastic
flair.
surgeon.
I have a theatrical flair when I say busted.
Oh no, that part I'm saying, yeah, like let's just, my point is like liposuction is not the thing.
It's not the
moving
thing.
on.
Yeah, moving on.
Yeah.
Later, see you liposuction.
Right, see you liposuction.
We're going on to brachioplasty.
Liposuction out.
Just my delivery now is just so much better than the first myth busting episode.
Yeah.
Why am I struggling to say myth? I don't have word problems.
Oh,
You are like a virus.
this is so satisfying.
It's on
I'll tell you this,
exposure.
Dr. Martin, I have been a woman my entire life. I've never thought that my arms were swollen with my cycle ever.
It's
Not
good
once.
that you're in of one
Yeah.
has described
Or have
all
I-
female experience.
Or have I ever had one of my friends be like, oh my gosh, I'm so arm bloated today.
Okay, well, I would take that from you.
Oh,
I
look
would
at my bloated arms.
I would take that from you if you had a lot of friends
My
to
uterus
reference.
is so bloated that it's showing in my arms. You're right. None of my friends are women.
Yeah,
So
that's true.
yeah, they don't have uteri.
How many female friends do you have?
None. I mean, well, that's not true. I mean, I would call my coworkers my friends, but I don't know if they would reciprocate that.
Contrary to Amy's version of reality.
Your uterus doesn't make your arms swell. Yeah, and if you do look back at the cover shot of Dr. Martin and I flexing, you see that like women have a lot less muscle density in their arms, and that's why.
I only flex near women.
Yeah, to make yourself.
I don't
feel
flex
good.
next to Nils or
gosh.
someone who has more body mass than I do.
Yeah,
We're making Nils out to be like some.
he's like a Nordic beast.
At some point, we have to show Nils.
We
People
have
are going
shown
to be
him.
like, "That's it."
Watch the 100th episode. Nils is all over it.
Oh, that's right. That's right. He's on there. Yeah.
Yep.
I'll use a picture of a scar.
There you go. Yeah. But the reason why
Thor.
normal weight people are going to need a brachioplasty is the same reason you need surgery on the rest of your body. Like your
Yep.
skin loses integrity, and there's a lot of gravity effect visible on the arms, and not a lot of muscle to hold it up. I mean, really, the musculature of the arms is is more simple. You know, it's in the upper part of the arm than it is in a lot of the rest of the arm. So it's just not as much there to hold it. And when you aren't holding that skin up is when it starts to look crepey and loose, even if your arms are very small.
Yeah.
Like you don't have to have lost a lot of weight.
I think brachioplasty needs a PR agent, you know?
It does.
Really
Like
does.
people think it, but this is it right here.
Yeah.
It's this episode. Yeah.
It's us.
We are.
Is brachioplasty going to pay us for all of our work?
Yes, it actually does. Sure does.
Oh, it does.
It does.
Okay.
Yeah.
Busted.
Busted. See?
It's literally perfect.
Oh man.
That just combined every part of all of us.
It pretty
together.
much did.
Love
That
it.
got all of us.
Yeah.
Yes. We got a flex for everybody
Yeah,
who's
we gotta
watching.
flex. We gotta
Yeah,
flex.
potatoes.
There we go.
Mm-hmm.
There we go.
Yep.
Nils
My
not
arms are
Nils
still
is not
way
allowed to
smaller than
flex.
Dr. Martin's
Yeah.
arms.
Nils is not allowed to flex.
Ladies, despite years of heavy lifting, I'm still nowhere near this.
Yeah.
It also shows how much fun those myth busting episodes.
Oh my
Oh,
gosh, they're the
We always
best.
get into great conversations, and you know, it's,
100%.
yeah, I love those.
And then, like,
Really
the listener episodes were some of my favorite. Well, my favorites are when Amy and I do what, things we're into and science stuff. But
Yeah.
like, that's for us. But the listener episodes overall are my favorite. And then the myth busting is my second favorite.
love them. Very good. All right, so to wrap it up, oh nope, sorry, Amy's clip first.
This is, and like I said, this is not only my favorite of the top fives. This is my favorite clip of the podcast. I
Yes.
feel like
Can I
ever.
guess it?
Yes,
So was this the counting sheep thing?
maybe.
Let's find out.
So my number one, when I sent it to Nils, I said, this is not only my number one clip of the year. It is might be my number one clip of all time. And then I wrote in parentheses, like, is definitely my number one clip of all time.
Okay.
All right, here we go. But really, when you look at this picture and you think to yourself, like, this is happening in my body all the time. There are all of these. How many cells, Nils, do you think are in the human body?
Oh, gosh.
Oh, really? You hit me with that?
Mhm.
2 trillion.
Okay, Dr. Martin.
Yeah. Damn. I'll just say 1 trillion.
So it's estimated that there are roughly 37.2 trillion cells in the human body. And some estimates have gone up as high as 100, depending on, some factors. But a minimum amount is between 30 and 40 trillion cells, individual cells.
That's insane.
Yeah. And when you think about that, it really becomes mind-boggling because what's going on inside every single cell
Right. And then now you can understand cancer. I wish you wouldn't have told me that.
it's so complex.
Right. Because I in my mind, I had 10 cells in there. That's all I got to do is manage
Right.
those 10.
Those 10.
It's like 10 sheep,
Yeah.
make sure they're groomed, make sure everything's okay. I just got this 10.
Got this
They
10.
got to graze a little bit.
Yep.
Now you're talking about 32 trillion sheep.
Mm-hmm.
Not going to happen, Amy.
Yeah.
That's a good one. That was so good.
I did not see that coming.
Yeah.
Like, I did not. Like, seriously, when I think of our podcast, like, that is my
We
favorite
really know
clip.
ourselves in our podcast.
We
I
do.
called that out.
Very
We had
impressive.
never had that conversation.
See, we hadn't. And if I were to pick your favorite clip, I don't know if I would have picked that one. I think I would have picked the one where we were talking about hip thrusting a car. But I didn't. I don't know.
That would be in my top 3, and I thought about that one. I wanted to pick one that kind of covered everything.
It did.
Yeah, but I remember the counting the 10 cells, like taking care of sheep and making sure they're okay.
Right. Like, keep them fed.
Can't do it. Can't do it.
Like, not going to happen.
Yeah, not going to happen.
And you guys pick the same clips a couple times. A couple of the episodes you guys have picked.
Yeah.
Maybe, but though you picked both the same number and the same clip that time.
Right. That's why I
And
picked
then
that
another
too.
one, like one
Yeah.
year 3 was another one's 2 or something.
That was kind of nostalgic
yeah,
for me too.
So it's
Yeah.
like,
We're on the same
they're
page.
I
great.
feel like one year we had a joint number 2
Yeah.
Yeah, it might have been.
that we just
yeah.
combined. Yep.
Yep. Like I said, I couldn't even remember how many of those we did until I went back. I was like, oh my gosh.
And there's another one coming in just 3 months.
Another one coming. There you
There
go.
we got Nils' favorite clip.
All
coming up.
right. Now my favorite clip. Here you go. 3, 2, 1.
Welcome everyone to Beauty and the Surgeon podcast. Ooh, way to sit up straight, Dr. Martin.
Just kind of.
Yeah.
You got to expand the chest
Yeah.
out, Amy.
I'm Amy. I'm a board certified
When did you go to plastic surgery school?
apparently in the last 20 minutes.
I love it. You're board certified in nutrition and plastic surgery.
Board certified plastic surgeon.
Oh, that's definitely going on the end of the year. I love it.
The compilation of intros. That's the first time I've ever messed up.
Yeah, I love it.
Wow.
Rarity right there.
All right.
Recount you?
Yep. Roll me in, Nils. Yep.
That's funny.
I knew that. I knew it had to be that one, or you saying that you were a man.
That's funny.
Yeah, I almost picked I'm a man.
I love how she's like a professional now. She's just roll
Yep.
it back up.
Roll
She's
it
like a
back. I had to keep
newscaster.
that in 'cause
She's
I
like a
love it.
newscaster.
Like, roll me back. But yeah, the only time you screwed up the beginning, and I just love your faces when you realize what happened. That was one of the biggest laughs we've gotten on
Oh man, that was
there.
so funny.
That was a good time.
Amy may be more of a plastic surgeon than some of the plastic surgeons I know.
Yeah.
But,
The
that's a
wealth
different
of
episode.
knowledge that
Yeah.
comes out of you guys, and the consistency of it, because I watch all of them. So
Yeah.
like,
Yeah.
there are times you'll get into something, and I'll be like, I know what they're gonna say because you give very
'Cause we've
consistent
educated
and
you.
very educated knowledge.
Yes.
And so like, I feel like sometimes you throw me way too hard quiz questions, but
Whatever.
besides,
else.
how many cells are in the body?
37
You're Viking
trillion.
smart. You should
Yeah,
know that.
Viking
It's 37 trillion. Some people think over 100 trillion.
All right. So we'd like to thank our non-sponsors.
Yes.
Oh, the bombshell booty
The
cushion.
people that we plug all the time.
Yes.
But Element has definitely sent us some, I got my water bottle.
Yes. Thank you,
got
Element.
some hats and some great, they've definitely sent us some stuff. But Bombshell Booty Pillow and the Squishmallows have made a lot of the patients comfortable over
Yes,
the,
they
the
have.
time. So keep plugging them.
And bombshell booty pillow reached out to me.
yeah. That
Yeah.
was,
We do love
That's great.
Element. Oh,
Yes.
they have it. Yeah.
I'm sure there are a few more too. I just couldn't think of them offhand. I just thought, we should thank our, because we also had sponsors.
Our ghost sponsors.
Yeah, I mean, when I was looking back, I was like, oh my God, the Let's Get Checked.
Let's get checked.
Was on there for years.
Yeah.
Like we had them as like a
I had to
sponsor for
spell
years.
out loud
Yes.
multiple times.
So yeah, and then we had a few others throughout the years, and then we just kind of decided, let's keep it to ourselves.
Yeah.
Good
But
on our
also,
own.
it's a lot of work making commercials, and we don't monetize very much off of anything.
No.
Of that, so
Oh, I did like Magic Mind. I mean,
Yeah,
I do still buy Magic Mind.
Yeah.
Did you ever drink those Magic Mind
I
Sleep?
did.
What'd you
I
think?
gave it to, I liked it.
They make
yeah.
you sleepy?
I don't know. I couldn't make my mind up, but it wasn't bad.
Hmm.
And they're small. The Magic Minds are small.
Yeah, they're just like
They're almost
a shot.
like a shot.
They're like a shot.
And they
yeah.
used you guys for a little commercial that they
Yes, they
posted
did.
and everything
Mhm.
else. So yeah, might have driven some
We're
people
famous,
our way.
Nils. We're famous.
Like, hey, anyone that we can put the podcast in front of to educate,
Yeah.
that's what we're going for. And speaking of, thank you to all of our listeners. That's we could. I mean, the comments and questions that we get are such a big deal because it means that people are listening and inquiring and everything else. So we're not just speaking into the ether. So, to the listeners, don't hesitate. If there is a question, if there's something you'd like us to go into more, if there's stuff like that, we love stuff like that. We just want to know what you want to know. So,
And just know when you send your question, a Viking will receive it. Actually, it's Amy. Now that she knows our telephone number, we should put that as one of our favorite episodes.
Me saying my bank account number for the phone number
Yeah.
or whatever random string of numbers is in my head.
So what do you think about 200 episodes, Amy? What's your general feeling?
I'm honestly, it's mind-boggling to me to think
Yeah.
that we have done 200 episodes.
Mhm.
And they all seem so fresh. That's the weird part. Like when I do the questions from listeners episodes, I mean, the ones coming up, our next two episodes are actually questions from listeners. And like people will comment on episode like 53. I'm like, oh my gosh, like how'd they
Yeah.
even find this one? What was our first videotaped one? Like in the
Our first
50s?
video
40
tape, I
something?
think it was 42.
That's what's crazier is that we had that
Um,
many episodes without video.
Yeah, because we were just doing
Yeah.
audio at that time, and mostly just because it's a ton more work to do video. So we were kind of feeling it out. We were just seeing like, hey, are people listening? Do you guys like doing it? That kind of thing.
Do we have enough to talk
Yeah,
about?
do you have enough to talk about?
Yeah.
Is this going to work? And as soon as it also having a good space to do it in, because we shot some things with like Dr. Metz and stuff
Yes.
like that. And,
Mhm.
the camera stuff was like, yeah, it is adding a little bit to it. And that's what I do is, all camera stuff. So
When he's not Viking.
when I'm not Viking. Yeah.
When you're not raping and pillaging people. Yeah.
How about you, Dr. Martin? Any comments on 200 episodes?
Well, I feel the same that Amy feels. I feel like this stuff is all right in front of me and it all is meaningful. And I think the main reason that is because I work with amazing people, Nils, Sarah, and Amy. And it makes it so joyous. And then the second part of it, we get to interact with listeners who are actually going through their own journey. And it makes us feel like we're adding to the ether, to the world, like adding to people's experiences, educating them, empowering them, and doing the things we can do to impart our knowledge over and also hopefully make it engaging and fun. This is such a niche thing, right? I mean, clearly everyone, the internet is not going to watch a plastic surgery podcast, but it's amazing how much engagement we get the duration of views, how long people view or listen. And we haven't even talked about the listening part of this. We are, in terms of ranking for podcasts on plastic surgery, very, very high. You can look at the rankings and definitely still even in the top 20. But we moved over to video, as you said, about like episode 55. And I think that was also good too, because that gave two different avenues for people to listen and watch us. So I'm super proud of this. One of the most proud of things I've ever been in my career, in my life, besides getting married and children and stuff. And I realized that this is a passion project for all of us, but that's what makes it so special and wonderful for all of us. And so hopefully, if you're watching this and you made it all through and you're like, what the hell are these people doing? Why is that guy dressed as a Viking? Why does she have a black, beautiful night, what do you call this? A night dress? What is this called?
Oh, this is a cocktail dress.
Cocktail dress and a tiara. And that dude looks like he's a surgeon. That could have been in Doctor Strange. Don't know. Hopefully, if you're watching this, you'll like and subscribe, and you'll follow us too, because we definitely have our own little clan. And that is
blah blah blah. That's proof.
Yeah, blah blah
And
blah
Jenny.
is one of them. Jenny,
And Robin, I got you too.
who was the lady with the large breast that hit the
Who's
wall
gonna
when
bash a boob?
bash a boob when she walked through the door. I have like 1,000 stories like that, and they're all real and they're all people. So thank you so much for your support. Seriously, thank you.
Nils, should I wrap it up?
One last thing. I just want to thank Sarah.
Yes.
Oh yeah,
Huge shout out to Sarah. We would not have slides without her.
Yeah.
we wouldn't have really much without her. Now,
Yeah.
Nils is amazingly talented, but Sarah, I mean, is like behind the scenes.
Yeah,
Amazing.
I have to bounce a lot of stuff out. Does this make sense? Does
Yeah.
this work? You know, and of course her design and everything. She's always super busy. She always fits it in. She always she always gets it. So, thanks to her. And I mean, I think that wraps up 200. So Amy, back to you.
It is very hard to spar with Sarah because she is a lefty. It messes with my dyslexia a lot. I always was worried that I was,
She is so sweet on the outside, but she has a
she
tough
packs a
inner core.
mean
Yeah.
punch. Yeah, I always told her, like, if you hit me, it's my fault because I was blocking wrong.
She's
'Cause-
kind of like those animals, like they're real fuzzy and cute looking until you get too close to them, and then they
oh, it's you know what?
That's Sarah.
She's like a hedgehog.
yes.
Like they look so cute
like
and
you want to
cuddly.
snuggle with
Like
it,
you
like a
want to
little
pick
baby
them up.
raccoon.
Yeah.
Like, oh, Sarah, you're so wonderful.
Well, they are until they aren't.
Yeah.
Like,
Now Sarah's
yeah,
amazing.
she is
Kind of a
amazing.
honey badger.
Yeah,
That's-
honey
Yes,
badger.
honey. See, I thinking more hedgehog.
Yeah.
Cute,
Yeah.
yeah, really cute. All right. Well, we thank you all so much for listening. If you would like to, you can find us on all social media handles here. You can also leave us a comment or you can send me a text at 303-630-9038. Our next episode is starting off with a text from a listener. So we answer those, and I like voicemails. If you go back and listen to our previous episodes, listeners from questions, we play the voicemail. So if you leave me a voicemail, you will hear yourself on one of our
And you'll
episodes.
be famous.
Yeah. But we will see you all here next time.
See you later. See you episode 300, Amy, next time.
Next time.